Type 1 diabetes is usually diagnosed in children and young adults and was previously known as juvenile diabetes. Only 5% of people with diabetes have this form of disease. In type 1 diabetes, the body does not produce insulin. Insulin is a hormone that is needed to cover sugar, starches, and other food energy needed for daily life. With the help of insulin therapy and other treatments, even young children can learn to manage their conditions and live longer, healthy lives. Diabetes is a problem with your body that causes blood glucose sugar levels that rises higher than normal. This is called hyperglycemia. Type 2 diabetes is the most common form of diabetes. If you have two types of diabetes, your body does not use insulin properly. This is called insulin resistance. At first, your pancreas makes extra insulin to make up for it, but over time it isn't available to keep up and can't make enough insulin to keep your body glucose at normal levels. The following symptoms of diabetes are typical. However, some people with type 2 diabetes have symptoms so mild that they go unnoticed. Common symptoms of diabetes: feeling very thirsty, feeling very hungry even though you are eating, blurry vision, cuts and bruises that are slow to heal, weight loss even though you are eating more, tingling, pain, or numbness in hands and feet. Fact: if you manage your diabetes properly, you can prevent or delay diabetes complications. However, diabetes causes more death a year than breast cancer and AIDS combined. 2 out of 3 people with diabetes die from heart disease or smoke. Being overweight is a risk factor for developing this disease, but other risk factors such as family history and age also play a role. Too many people disagree that. Oh my God, what is that? Disregard the other risk facts of diabetes and think that weight is the other risk fact or type 2 diabetes. Most overweight people never develop type 2 diabetes, and many people with type 2 diabetes are at normal weight or only moderately overweight.
It is not so simple. Type 1 diabetes is caused by genetics and unknown factors that trigger the onset of the disease. Type 2 diabetes is caused by genetics and lifestyle factors. Being overweight does increase your risk for developing type 2 diabetes, and a diet high in calories from any source contributes to weight gain. Research has shown that drinking sugary drinks is linked to type 2 diabetes. The American Diabetes Association recommends that people should avoid intake of sugar-sweetened beverages to help prevent diabetes. Sugar-sweetened beverages include beverages like regular soda, fruit punch, fruit drinks, energy drinks, sport drinks, sweet tea, other sugary drinks. These will raise blood glucose and can provide several hundred calories in just one serving. Just one 12-ounce can of regular soda has about 150 calories and 40 grams of carbohydrate. This is the same amount of carbohydrate and 10 teaspoons of sugar. 1 cup of fruit punch and other sugary fruit drinks have about 100 calories or more and 30 grams of carbohydrate. A healthy meal plan for people with diabetes is generally the same as a healthy diet. For anyone low in saturated and trans fat, moderate in salt and sugar, with meals based on lean protein, non-starchy vegetables, whole grains, healthy fats, and fruits. Diabetic and dietetic foods generally offer no special benefit. Most of them still raise blood glucose levels, are usually more expensive, and can also have a laxative effect if they contain sugar alcohols.
Hypoglycemia. In 2011, about 282,000 emergency room visits for adults aged 18 years or older had hypoglycemia as the first listed diagnosis as diabetes as another diagnosis. Hypertension in 2009 to 2012 of adults aged 18 years or older with diagnosed diabetes, 71% had blood pressure greater than or equal to 140 to 90 millimeters of mercury or used prescription medications to lower high blood pressure. Dyslipidemia. In 2009-2012, of adults aged 18 years or older with diagnosed diabetes, 65% had blood LDL cholesterol greater than or equal to 100 milligrams DL or used cholesterol lowering medications. CVD death rates. In 2003 to 2006, after adjusting for population age differences, cardiovascular disease death rates were about 1.7 times higher among the aged 18 years or older with diagnosed diabetes than among adults without diagnosed diabetes. Heart attack rates. In 2010, after adjusting the population age differences, hospitalization rates for heart attack were 1.8 times higher among adults aged 20 years or older with diagnosed diabetes than among adults without diagnosed diabetes. Stroke. In 2010, after adjusting for population age differences, hospitalization rates for stroke were 1.5 times higher among the adults with diagnosed diabetes aged 20 years or older compared to those without diagnosed diabetes. Blindness and eye problems. In 2005-2008, of adults with diabetes aged 40 years or older, 4.2 million, 28.5% people had diabetic retinopathy, damage to small blood vessels in the retina that may result in loss of vision. Kidney disease. Diabetes was listed as the primary cause of kidney failure in 44% of all new cases in 2011. In 2011, 49,677 people of all ages began treatment for kidney failure due to diabetes. In 2011, a total of 228,924 people of all ages with kidney failure due to diabetes were living on chronic dialysis or with a kidney transplant. Amputations. In 2010, about 73,000 non-traumatic lower limb amputations were performed in adults aged 20 years or older with diagnosed diabetes. About 60% of non-traumatic lower limb amputations among people aged 20 years or older occur in people with diagnosed diabetes. $245 billion total cost of diagnosed diabetes in the United States in 2012. $176 billion for direct medical costs and $69 billion in reduced productivity. After adjusting for the population age and sex differences, average medical expenditures among people with diagnosed diabetes were 2.3 times higher than what expenditures would be in the absence of diabetes.
What is diabetes? Diabetes is a disease in which the body is unable to properly use and store glucose, a form of sugar. Glucose backs up in the bloodstream, causing one's blood glucose, sometimes referred to as blood sugar, is too high. There are two major types of diabetes. In type 1, formerly called juvenile onset or insulin dependent diabetes, the body completely stops producing any insulin, a hormone that enables the body to use glucose found in foods for energy. People with type 1 diabetes must take daily insulin injections to survive. This form of diabetes usually develops in children or young adults, but one occur at any age. Type 2 diabetes, formerly called adult onset or non-insulin independent diabetes, results when the body doesn't produce enough insulin and or is unable to use insulin properly. This form of diabetes usually occurs in which people who are over 40, overweight, and have a family history of diabetes, although today it is increasingly occurring in younger people, particularly adolescents. Adolescents? I don't know. How do people know if they have diabetes? People with diabetes frequently experience certain symptoms. These include being very thirsty, frequent urination, weight loss, increased hunger, wounds that won't heal, extreme unexplained fatigue. In some cases, there are no symptoms. That this happens at times with type 2 diabetes. In this case, people can live for months, even years, without knowing they have diabetes. This form of diabetes comes on so gradually that symptoms may not even be recognized.
Cholesterol is a wax fat-like substance that your body needs, but when you have too much in your blood, it can build up in your walls of your arteries. This can lead to heart disease and stroke, leading cause of death in the United States. About 1 in every 6 adult Americans have high cholesterol. Anyone, including children, can develop it. Several factors that are beyond your control can increase your risk. These include your age, sex, and heredity, but there are some risk factors that you can change. Examples include eating an unhealthy diet, being overweight, and not getting enough exercise. High cholesterol itself does not have symptoms. Many people do not know their high cholesterol level is. That's why it's important to schedule a regular visit with your doctor. Be sure to ask about having your high cholesterol tested. Doctors can do a simple blood test to check your cholesterol. Most adults should get their cholesterol level checked every 5 years if your total cholesterol is 200 or more, or if your HDL is less than 440, you will need to have a lipoprotein profile blood test done. Ask your doctor about what may be right for you. How is it treated? Lowering high cholesterol levels is important for people at all ages with and without her disease. If you have high cholesterol, you will need to eat a healthy diet. Quit smoking, and you may not need to take medicine. Can it be prevented? You can take several steps to maintain a normal cholesterol level. Eat healthy diets, a high amount of saturated fat and cholesterol in food that you can eat increase blood cholesterol. Tips on reducing saturated fat in your diet are available on the website of CDC division. Maintaining a healthy weight. Being overweight can increase your cholesterol levels. Losing weight can help lower your LDL cholesterol and total cholesterol levels, and raising your HDL good cholesterol levels. CDC healthy weight website is included. Increase regularly. Regularly physical activities can help lower LDL cholesterol and raising HDL cholesterol. You should try to be physically active for 2 hours and 30 minutes each week.
Don't Smoke CDC's Office on Smoking and Health website has information on quit. Cholesterol is waxy, fat-like substance that travels through the blood on proteins called Lipoproteins, it comes from two sources. It's made by your body and used to do important things like make hormones and digest fatty foods. It's found in many foods like egg yolks, fatty meats, and regular cheese. When your body has too much cholesterol, it can build up on the walls of your blood vessels. These deposits are called plaque. As your blood vessels build up plaque deposits over time, the inside of the vessels narrows and allows less blood to flow through to your heart and other organs. When plaque buildup totally blocks a coronary artery carrying blood to the heart, it causes heart attack. Another cause of heart attack is when plaque deposits burst and release a clot in a coronary artery. And angina is caused by plaque partially blocking on coronary artery, reducing blood flow to the heart, causing chest pain. Molecules called lipoproteins carry cholesterol in the blood. Two important kinds of lipoproteins are low-density lipoprotein LDL and high-density lipoprotein HDL. When checking LDL and HDL, doctors often include another type of fat called it's a really big word. Skip it. Total cholesterol is a measure of the total amount of cholesterol in your blood and is based on the HDL and LDL and triglycerides numbers. LDL cholesterols make up the majority of the body's cholesterol. LDL is known as bad cholesterol because having high levels can lead to plaque buildup in your arteries and result in heart attack, disease, and stroke. HDL cholesterol absorbs cholesterol and carries it back to the liver, which flushes it from the body. HDL is known as good cholesterol because having high levels can reduce the risk for heart attack and stroke. Triglycerides are a type of fat found in your blood that your body uses for energy. The combination of high levels of with low HDL cholesterol or high LDL cholesterol can increase your risk for heart attack and stroke. Know your risk. Your health care team can do a simple blood test to check your cholesterol levels. The test is called a lipid profile. The test measures several kinds of total cholesterol, and its individual parts include triglycerides. Some doctors do another blood test that checks total and HDL cholesterol. Whether your lipid levels require treatment is not solely based on your lipid profile numbers.